Thank you. Good afternoon and welcome to the 8th convening of the State of the Health of Chicago and the first session of 2021. The Institute of Medicine of Chicago is conducting a full series of virtual sessions. If you are new to the Institute of Medicine Chicago, welcome. If you're familiar with the IOMC, thank you for your support. I'm Dr. Cheryl Rucker-Whitaker. I'm President and Chair of the Institute of Medicine of Chicago and the CEO of Complete Care Management Partners. We want to warmly welcome you to the program entitled Closing the Health Gaps from COVID-19 in Cook County and the Collier Counties of Chicago. This program is incredibly timely as we're going to discuss the progress, problems, perspectives, and the efficacy of partnerships and learning from them and working with one another across 3 counties, Cook County, DuPage, and Lake County. You will take away all of these updates with you today as well, from a post-election perspective. So while the temperature is cold outside today, you will find hopefully warmth and some unity here as we're all working together to solve the problem of the pandemic crisis here in Illinois. We know that each one of you may have a different role to play here, but we're all united by the same purpose. We want to reduce disparities, safeguard our communities, and create healthcare equity, opportunities for equity, and promote well-being physically, mentally, and across the socioeconomic sort of spectrum. So together we can make changes that are very good for all. About the Institute, we are an independent organization of distinguished leaders in the health and in the health field who work together collaboratively to improve the health of the public. We try to lean on our diverse membership and other regional leaders to address critical health issues through a range of interdisciplinary approaches to education, research, communication of trusted information, and community engagement. So our agenda includes presentations from the counties, and then a panel discussion that'll be moderated by Dean Giles, and a Q&A session. Our upcoming programs here at the IOMC include Racial Inequity in Healthcare panel on February the 19th. We will be launching an implicit bias recognition training in late March, which is actually sponsored by Blue Cross Blue Shield, and more will be announced soon. Please save the date for our annual meeting. It's June 25th of 2021. Right now, that's expected to be virtual, where the Institute will have its bylaws business meeting, induction of the new Board of Governors, and an update on the program and our State of the Health of Chicago report. This program is accredited by Rush University and affiliated associations. You will be able to obtain your continuing CME credit at the end of the program by completing the online evaluation form. All speakers met the disclosure requirements for this program, and their information is on file with Rush University. Deborah, go back a couple of slides. At the end of this program, you will be able to meet these 3 learning objectives and put them in practice with your teams and colleagues. They include identify the gaps and obtain the latest information on hotspots in 3 counties, summarize their progress with addressing health gaps in the vaccination plan, and describe how partnerships are solving, some examples of how partnerships are solving challenges and problems related to the pandemic. We'll thank our sponsors, Blue Cross Blue Shield. We've got a wonderful list here: Northwestern, Rosalind Franklin, University of Chicago Medicine, the Portis Foundation, Michael Reese Research and Education Foundation, the Washington Square Health Foundation, the Hectone Institute, Next Level Health, Aunt Martha's Health and Wellness, Care Advisors, and Golden Square. And we're right on schedule. We're going to jump now into introducing our panelists for today and getting started with this really great conversation. I'm just looking forward to hearing from all of our panelists today. Dean Giles, very excited to have you here with us today. Dr. Wayne Giles is a Dean of Public Health at the University of Illinois at Chicago. He is, prior to joining the University of Illinois at Chicago, in September of 2017, he was director of the Division for Heart Disease and Stroke Prevention in the National Center for Chronic Disease Prevention and Health Promotion at the CDC. He also led the Division of Population Health at the CDC, which is one of the CDC's most diverse divisions with programmatic and research activities in community health promotions, arthritis, aging, healthcare utilization, and racial and ethnic disparities in health. His past work experience has included studies examining the prevalence of hypertension in Africa, clinical trials evaluating the effectiveness of cholesterol lowering agents, and studies examining racial differences in the incidence of stroke. He has over 150 publications in peer-reviewed journals and has authored several book chapters. He has been the recipient of numerous awards, including the Centers for Disease Control and Prevention's Shepard Award in Assessment and Epidemiology and the Jeffrey Copeland Award. He holds a bachelor's degree in biology from Washington University, a master's in epidemiology from the University of Maryland, and a doctor of medicine from Washington University. His residencies in both internal medicine at the University of Alabama, Birmingham, and preventive medicine at the University of Maryland. Dean Giles, welcome and thank you for being here with us today.
Dr. Whitaker, it's a pleasure to be on the panel today. Thank you very much.
Very good. I would also like to introduce three public health leaders from Cook County and Lake County, Dr. Kiran Joshi and Dr. Rachel Rubin of Cook County Department of Public Health, and Mark Pfister from Lake County. Dr. Joshi currently serves as Senior Medical Officer and co-lead of the Cook County Department of Public Health, where he oversees the department's behavioral health, chronic disease, communications, community engagement, lead poisoning prevention, and epidemiology units. He's also an attending physician with the Department of Family Medicine at Stroger. Since joining CDDPH, Dr. Joshi has been responsible for supervising the development of We Plan 2020, the Community Health Assessment and Improvement Plan for suburban Cook County, advancing health equity as an agency and community health priority, and co-developing the agency's response to the opioid overdose epidemic. He's currently an assistant professor of clinical family medicine at the Northwestern University Feinberg School of Medicine. Thank you so much, Dr. Joshi, for joining us today. Dr. Rachel Rubin, hello, Dr. Rubin, is a senior medical officer and co-lead of the Cook County Department of Public Health as well, and is board certified in internal medicine and preventive medicine with an occupational medicine concentration. She's worked for the Cook County Health and Hospital System for most of the last 33 years and has served as the Assistant Program Director for the Internal Medicine Residency and the Chair of the Division of Occupational and Environmental Medicine, and serving as the Program Director of the combined Internal Med, OCMED program residencies during that time. She's worked for several years as a primary care internist with the Cook County Ambulatory and Community Health Network and continues her clinical duties at the Core Center. She moved into the senior medical officer position with Cook County in 2014 and assumed the role of co-lead of the department in 2020. Her main areas of responsibility include oversight of the Communicable Diseases Unit, Environmental Health Services Unit, Integrated Health Support Services, and the TB Medical Services, as well as leading the Quality Improvement Program of the agency. She's served as the agency's incident commander for the COVID-19 response. And she has many years of experience training, mentoring, supporting residents. She's adjunct faculty at the U of I School of Public Health. We are very happy to have you here with us today, Dr. Rubin. Thanks for joining us.
Thank you very much.
Mark Pfister is the Executive Director of the Lake County Health Department and Community Health Center since 2017. Mark believes that many of the problems plaguing our Illinois communities, like obesity and associated chronic and infectious diseases, are linked to the social determinants of health. So that identifying and addressing these social determinants should lead to improvements in health and well-being. He has over 30 years of experience as a public health executive and ecologist. Since 1991, he has served in several leadership positions with the Lake County Health Department and Community Health Center. He's served as interim executive director and director of prevention and population health services, director of prevention and population health. And was also in the past an associate instructor at the Indiana University and a past instructor of biology and genetics. Mr. Pfister, we're very happy to have you here today with us. Thank you for joining us.
Thank you, a pleasure to be here.
Dr. Giles, I ask that you will lead us with the presentations and discussions of this group of scholars, and we look forward to the presentation.
Thank you very much, Dr. Whitaker, and it's a pleasure to be here. And be, so why don't we go ahead and have the two presentations from Dr. Joshi and Dr. Rubin from Cook County, and then we'll follow that up with presentations from Mr. Pfister.
Thanks so much, Dr. Giles. Thanks, Dr. Whitaker. I apologize I couldn't unmute myself earlier. I'm so thankful to IOMC for hosting this event and really just thrilled to be a part of this august panel. Next slide, please. So I think at this point, everyone is familiar with the CDC phased approach, which began earlier this year. With hospitals vaccinating their own healthcare workers. Of course, we began there because they were among the highest risk of exposure. And I'm sure, you know, given the audience I'm speaking with today, that you're also well aware that phase 1A also includes long-term care facility residents and personnel, as well as community-based healthcare workers, and this includes members of the EMS sector as well. You can see from the diagram on the right-hand corner of the slide here that there's not going to be this sort of clean on-off switch as we move between phases. Rather, we do expect to see a tapering off of one phase and the gradual beginning of another phase, and they will potentially overlap quite a bit. While we believe in suburban Cook County, the majority of eligible and willing phase 1A participants have been vaccinated, we are still seeing a few being vaccinated in our sites. Next slide, please. And again, we know phase 1B is frontline essential workers and individuals over 65. This is a deviation from the CDC guidance prompted by IDPH's considerations that people of color generally have been becoming ill with COVID-19 more frequently than their white counterparts, and potentially at a younger age as well. Notably in the group of frontline essential workers, there is the inclusion of a number of folks who are low-wage workers that are out there doing work and faced with the critical decision of going out to work and getting a paycheck, or going home and you know, avoiding the potential exposure that they would experience in their day jobs. Phase 1C is essentially all other essential workers and persons aged 16 to 64 with high risk conditions. CDC has defined these conditions after reviewing the evidence on which confer the greatest risk for COVID-19. And they run the gamut from type 2 diabetes to heart disease. And phase 2, moving on, is essentially everyone else that wasn't previously included. Next slide, please. So our strategy, given the magnitude of our jurisdiction, which is suburban Cook County, and includes 2.4 million people, is that partnerships were going to be crucial to getting to the goal of 70% vaccine uptake required for herd immunity. And so our overarching strategy was to leverage existing healthcare infrastructure where it was available. And we've been working jointly with our colleagues at Cook County Health to identify critical populations, you know, potentially standing up mass vaccination sites and essentially working to bridge gaps in coverage. Next slide, please. And here I'm going to turn it over to my colleague, Dr. Rubin.
Yeah, thank you, Dr. Joshi. So this is what we're calling our access points through the partnerships that we've been developing to try to address vaccination in general, but specifically also trying to get at areas of the community throughout suburban Cook that are most vulnerable and underserved. And so what we know is that we have to, as Dr. Joshi has talked about, we have to have a wide range of partners throughout the community, because our health department cannot go out and vaccinate directly. We need to leverage these partners, whether it's within our own Cook County health system, and the clinical side of the system has really stepped up, or through these particular partnerships. So There is a federal pharmacy partnership where the federal government has had agreements with CVS and Walgreens to provide vaccine to long-term care facilities. So that includes skilled nursing facilities and nursing homes, as well as assisted living. It does not include independent living for seniors at this point. So this is a program where the vaccination is pushed out directly to these partners, CVS and Walgreens. It bypasses the state allocation system, and it goes directly to these partners and specific, all of the long-term care facilities, the vast majority of them signed up ahead of time to receive vaccine through this partnership. In addition, we have 15 hospitals throughout suburban Cook in our jurisdiction, and we have partnerships with all of them. And they started out by vaccinating their own personnel and also opened that up to some level of community-based healthcare workers, including EMTs and paramedics. And especially a shout out to our partners, Loyola and the Advocate System, that are sort of the larger systems within our jurisdiction, where they have ramped up not only to do 1A, but they are committed, as the other hospitals now are coming on board with being committed to vaccinate beyond their own immediate catchment of their own staff and their own patient base, especially as we moved into 1B, but also to open up to community vaccination beyond those that are affiliated with their health systems. And then we have also contracted with pharmacies beyond the federal partnership, leveraging Jewel Osco, additional Walgreens outside of the federal partnership program, Mariano's. So those are the three big ones. We have other arrangements in the works to provide vaccine for 1A, and now we're into 1B. And it's not all of their sites, but every day more and more of their particular sites within these partnerships are coming on board. The rate limiting step is the supply of vaccine. We don't have enough vaccine to give these partners in order to be doing the vaccination that's needed. We next have federally qualified health centers, and especially a shout out to Oak Street Health that has facilities in suburban Cook as well as the city of Chicago, and they have been tremendous in reaching out beyond their immediate doors and their immediate patient base to vaccinating throughout the community. And then we are working on what we're calling our hyper local site program, and working with schools as well as EMS via fire departments to do vaccinations of especially the frontline workers as we roll into phase 1B. So that includes partnerships with schools, and we have 162 school districts, 162 school districts in suburban Cook. But they are grouped into three major Board of Education regions, and part of those regions include 12 regional high schools. So we're working through that regional high school network to identify specific ones in different areas to roll out vaccinations that will focus on educators and education staff, and then also potentially serve as larger community sites. So those we are beginning to work on now. Next slide, please. Thank you. So these are access points that are managed directly with our Cook County Department of Public Health and the clinical side of our system, Cook County Health. So there are 13 ambulatory and community health networks. So they're health centers. 6 are in the suburban area and 7 are in the city. So the city of Chicago is providing vaccine for those locations in the city, and we're providing vaccine for the suburbs. They have been stepping up, our CCH partners, tremendously, along with the National Guard, to do large vaccination sites. This past week, we have opened up one at Tinley Park Convention Center, and it's been going extremely well. We are planning to do drive-through sites, potentially in collaboration with our Forest Preserve District of Cook County, once the weather permits, to have drive-through sites in areas that allow open space and parking and such, so people can drive through and get vaccine. We're working on mobile vaccination plans through a couple of mobile units that we have, as well as potentially ones we can leverage with other partners to provide on-site vaccinations to specific communities, especially those that we know where there is a gap in access to a local pharmacy, where there isn't transportation to get to a pharmacy. This might also include senior buildings where people have mobility issues. So we're going to be using our mobile vaccination system for that. And that is part of the strike teams, the mobile vaccination and the strike teams. The strike teams, I guess, are even more hyper-local than the mobile vaccinations, but we really want to vaccinate to the priority groups, doing them on site, such as, senior centers that I had just mentioned. And that will be staffed jointly with the Cook County Department of Public Health and leveraging our retail pharmacy partners, and potentially we'll see how far we are able to leverage the National Guard as well. Next slide, please. Finishing up here. All right, so this is how people can sign up. We have a new, what we're calling our microsite, which is vaccine.cookcountyil.gov. And this is where people can go to sign up to get vaccination information, to register their interest in vaccine. And then they are linked directly to be able to make appointments within the Cook County Health System, which includes those 13 community health centers, as well as these large sites like we're rolling up in Tinley Park, and we have more to come for those in the future. And then if all of those sites, those appointments are filled, people will then also be directed to the local link to a pharmacy. You put in your zip code and then it'll link you to possibly a Walgreens or a Jewel Osco or Mariano's that's in your community, or an FQHC where they can go and get vaccinated. So this is all now put onto one site where you get links to make vaccination appointments, or where appointments are, the appointment system is built in for Cook County Health. Next slide, please. Okay, so health equity, right? This is key and core to our decision-making for all of our programmatic work. Our mass marketing campaign, and we are building one up now for vaccine, is really meant to, we'll have a hyper-local messaging involved, and our community-based organizations that we are working with will be able to use those marketing materials and reach out to those communities that are most in need and are most underserved. And that's where our community-based organizations are situated and work. And we also are engaging, of course, community leaders to directly gain support and confidence in the vaccine. Next slide, please. Okay, there we go. Thank you very much. And I
Thank you very
pass
much.
it off.
Okay, thank you very much, Dr. Rubin, Dr. Joshi. I'm going to pivot to hear from Mark Pfister in Lake County about closing the gaps.
Thank you, Dean. So I'll go ahead and go to the next slide. Thank you. So just to start out with a little epidemiological data, is that this was the situation that all of us pretty much experienced in every county in Lake County, is that we had this bimodal distribution. We had the start of it in March, and then we had the big peak back in the May, April area. And then we had the super peak, starting in November of this year. But I do want to caution everyone is that first peak, we had very limited testing. And so during that time frame, what is interesting is that our positivity rates were extremely high, because the only people that were being tested were those that actually had symptoms of COVID-19. So we were missing a lot of those asymptomatic individuals. So next slide. And then with that first peak, you can see on this is incidence. So this is the number of new cases per 100,000 residents in Lake County by race and ethnicity. As you can see, that blue tends to be the highest curve. Other non-Hispanic was something interesting in the second. It was just not being captured well with the data sets that we were receiving. But clearly what we saw in Lake County was that the Hispanic population had a significant burden, and then followed by the African-American population in green. But you can see that Hispanics and African-Americans were at the top of our incidence in Lake County. Next slide. And so when we age adjust this data by white, black, and Latinx, is that what we saw in May is that for every one white Caucasian non-Hispanic that had COVID-19 or was positive, we had about 4 African Americans and about 8 Latinx. And so that was something that was very interesting to us, is that it seemed like the burden was really being pushed to different communities where we had greater populations of Latinx and African Americans. And then you can see that that trend dropped off a little bit in January, where we had about 2 times the proportion and 4 times for Latinx. But what we found in common in all of these areas was that Blacks and Latinx were living in multi-generational homes. They were also frontline essential workers, and they did not have the ability to isolate or quarantine well. A lot of these homes, much smaller square footage. And so that is one theory that we have as why we had a greater incidence and prevalence in those populations. Next slide. So just looking at Lake County is a very diverse county. We have extreme wealth, and then we have extreme poverty. And where we see that poverty is up in the northeast corner of our county, where we have cities like Waukegan, North Chicago, and also out west like Round Lake. And so if we look at our poverty rates across Lake County, we're at about 21% poverty for Blacks, Hispanic, Latino, 14.2%, and then white, 6.9%. So you can see that as you move south in Lake County towards Cook County, is that the median income goes up pretty dramatically. What's interesting is you have the mirror image between income, and this goes back to social determinants of health. We see this in many different disparities of health, that you see the COVID-19 prevalence was much greater in areas of greater poverty. Again, many theories on that, but we believe that it's that essential frontline worker. We had many individuals that were working not only one job, multiple jobs, and then getting into contact and not having appropriate PPE. Next slide, please. So what did we do about this? Early on is that we found that, our communication methods, really were challenged. Is how do we best communicate and how do we attempt to prevent COVID-19? So early on, we created 2 groups, the African American Community Partnership Group and also a Latinx group that we started meeting with to come up with really culturally tailored education and outreach. One of the things that they all said was that they didn't have essential goods. These individuals did not have masks. They did not have hand sanitizer. So that was something that we worked on with them to get CARES Act funding to help pay for that. And then they distributed it to multiple individuals. And then in certain communities, we actually funded, like the bus tail ad that you see in the slide, Mask Up Today. And then we also reached out in these communities to actually have kids draw different educational methods. And so at the bottom, that's our youth mask design contest winner. And so they hit all the right things. So washing hands, wearing a mask, and watching the distance. Next slide, please. So when we talk about employment, staying on that same concept, is that employment security, you can see that the orange line, we had a very large reduction in employment due to COVID-19. It really dipped in April, and then it went up, but it's plateaued since that time. We were seeing a little bit of a reduction in the high employment coming out of 2019, but clearly this was a major issue. We had many small businesses in Lake County that were dramatically impacted, especially in the areas most impacted by COVID-19, Round Lake, Waukegan, and Mundelein. So the other good news is that my county board has been extremely supportive, and they allocated $17 million for small business and economic assistance. Next slide. One of the other things that we found during COVID-19 was food insecurity. And so the Northern Illinois Food Bank has been very active in Lake County, delivered over 10 million meals in 2020. That's a 97% growth compared to 5.1 million. Another thing that we started here in Lake County is something called Lake County Catch. And so community action to counter hunger. And this was a community-led intersectoral coalition. And so we ended up delivering food to those in quarantine and isolation, because that was another thing that we identified, was that people were not able to quarantine and isolate because they felt that they needed to continue to work to get food. So we actually delivered to 770 families, over 16,000 meals, hot meals that were delivered to these families to make sure that they stayed in quarantine and isolation. Next slide, please. Then we talk about housing insecurity. So we also provided rental and utility costs. And again, you can see coming out that 60085 and 60064, that is the North Chicago and Waukegan zip codes, as well as out west, the 60073 zip code, that is Round Lake. So you can see a theme here is that we had a lot of different ways that we needed to assist our residents. Housing insecurity was a big one. And then we also, going back to that comment I made earlier about square footage and just being able to quarantine and isolate, is that we did have and still do an alternate housing site where we were having people go into motels. We provided up to 14 days of housing for them temporarily. Meals were brought to those hotel rooms or motel rooms. And then we also checked in every day if they were COVID positive. We did check in with them on a daily basis to assure that they were doing fine and that their recovery was going well. Next slide. So to add on to Rachel and Kiran's presentation is with vaccinations, what we have found that both the Black population and Latinx population have very strong vaccine hesitancy. So we created what we called community health ambassadors. And so we're having them help register our community into our allvax.lakecohealth.org vaccine registration system, which we now have 300,000 residents in Lake County registered in that system. Also walking, providing guidance because some individuals do not have access to the internet. So walking them through that using the phone, et cetera, and promoting, different registration through their websites, social media, et cetera. And so go ahead and click on that slide. And so these community health ambassadors receive optional training sessions, step-by-step registration guidance, answer to FAQs, promotional materials, and then recognition. But this is something that is absolutely huge in Lake County. We are seeing a large disparity between the number of residents in Lake County that are registered in our all-vax system. The majority of people that are registered in our system are more from those affluent areas. So these community health ambassadors are key. This is faith-based individuals. These are individuals that, are trusted community-based organizations or trusted community members. And so we're really trying to reduce the vaccine hesitancy in these populations that were most dramatically impacted. So that is the end of my slide presentation. So thank you.
Thank you very much for that outstanding presentation. That was great, Mark. Really appreciate it. I want to encourage people in the audience to enter questions. We've got a couple of them in the Q&A, but please continue to enter questions into the Q&A section as we move forward. It gives me great pleasure to introduce two additional speakers with outstanding experience in public health and health scholarship. Our first speaker is Dr. Jackie Rouse, who works with Advocate Aurora Health and has over 25 years of community health and public health experience. She served as Director of Community Health in the South Region of Advocate Healthcare, which includes the development of a community health strategy at Advocate Trinity, Advocate South Suburban, and Advocate Christ Medical Center. At Advocate Aurora Health, she developed several innovative community health programs, including a workforce development and job shadowing program for high school students. She initiated Advocate Health's first community health worker program, which extends care beyond the hospital. She also serves as the lead in collaboration with other health entities to address violence in Chicago's communities through the Southland Rise Initiative with the University of Chicago Medicine and Senator Dick Durbin's Chicago Heal Initiative. She was inducted as a fellow in the Institute of Medicine Chicago in July of 2019. She holds a Bachelor's of Science degree in Medical Technology from the University of North Texas, a Master's of Science degree in Healthcare Administration from Texas Women's University, and a Doctorate of Public Health degree from Walden University. So welcome to you, Dr. Rouse. Our second presenter today is Ms. Nanette Silva. She currently serves as Program Director at the Community Memorial Foundation, where she has worked since 1999. She currently manages the implementation of the Regional Health and Human Services Agenda for the Western Suburbs. Previously, she administered the Community Health Network of the Western Suburbs, and before that managed the Early Childhood Initiative. She has worked in philanthropy for over 25 years and has also served as director of the Women's Health Initiative and later served as program director at the Chicago Foundation for Women. Prior to her work in philanthropy, she worked for several years in both the nonprofit and academic research arenas, including the fields of domestic violence, HIV/AIDS risk reduction in women and adolescents, teen pregnancy prevention, smoking cessation, and behavioral health. She has served for 5 years as co-chair of the City of Chicago Partnership for Public Health with the city's health commissioner. She's also served on planning teams for Cook County Department of Public Health on the State Health Improvement Plan and for the DuPage County I-Plan. She is currently vice chair of the AIDS Foundation of Chicago and has served on the boards of the Chicago Women in Philanthropy, the Heartland Alliance, Heartland Health Outreach, the Illinois Center for Violence Prevention, the Illinois Association for Infant Mental Health, and is a founding member of Chicago Latinos in Philanthropy. She holds a Master's of Public Health degree from San Diego State University and a bachelor's degree in psychology and Spanish from Dominican University as well. I want to first congratulate everyone. We are right on time, and I'm going to ask both Dr. Rouse and Ms. Silver to reflect on the presentations we've heard from our colleagues in Cook and Lake counties. And what do you see as some of the major steps we need to close the gaps around COVID-19? And specifically, who are you partnering with and what strategies are you undertaking to address those gaps?
Yes, so this is Jackie. I can take that question first. So the major steps that we need to close those health gaps, those presentations are right on point as to what we are experiencing in our communities. And so I would say there are three major steps that I would consider to close those gaps. And the first one is to use data. Some of the data that you have seen has really highlighted what communities need the most help. And so understanding those gaps, where those gaps are, what communities they are, and really helps us to identify the needs of the community and what those communities' issues are that address health equity. The second thing I would say we would need to do is really, as entities, really dedicate the appropriate resources to addressing those health gaps. When I say appropriate resources, as we identify that some of our communities are not able to access services or to even have emails or access to technology, it is very important to dedicate resources to identifying that and to address those gaps so that we can have the vaccine uptake that we are expected and reach that herd immunity. The third thing I would say is developing partnerships. A lot of both of our speakers talked about partnerships. Partnerships are key to being able to meet the goals of getting this vaccine out. And it's not just partnerships with the health entities, it's really partnership with the community residents, and hearing their voice and speaking to them to understand what their fears are, educating them as to taking this vaccine and to work with them hand in hand to reach out to other community members. So for Advocate Aurora, we have worked with all of the collar counties in each of our service areas. And in particular, I've worked with Cook County in the South region, in the northern region, and also with City of Chicago. And then we also work with many collaborations with the health system. We have worked with, incidentally, there are a lot of collaborations, new collaborations forming just because of of the COVID-19 pandemic. And one example I can think of is health systems coming together to address the homeless. And then also working with those homeless organizations to address their needs and to really reach out into the community. Thank you.
Thank you. And Ms. Silver, anything you have to add?
Yes, thank you. First of all, I want to say good afternoon and thank you for having me. Community Memorial Foundation serves the western suburbs of Chicago, including Western Cook and southeastern DuPage. Despite lingering assumptions that the suburbs remain the homogeneous relics of the 60s, over our 25 years of service, we've witnessed the rapid changing of demographics in our communities and have worked to respond to the changing needs in an equitable manner, together with our grantee partners, the community-based organizations in our region. We've also maintained close relationships with both the Cook County Department of Public Health and the DuPage County Health Department, serving on various strategic planning task forces. Reciprocally, Dr. Kiran Joshi sits on the Community Memorial Foundation's Regional Health Agenda's Implementation Council, where he has passionately advocated for further strengthening our commitment to racial equity. But we're just one foundation. So we work closely with our Health Foundation partners in Metro Chicago. From the beginning of the COVID-19 pandemic, private health funders serving Collier County has reached out to Collier County Health Department colleagues to receive regular updates and to begin to strategize how private health philanthropy and public health departments might work together to further enhance the public health infrastructure, not just during COVID, but also to use lessons learned once we move post-pandemic. With the racial uprisings beginning in June, the conversation further enhanced its racial equity and justice framework, and these conversations continue into 2021. Chicago area-based health philanthropy continues to develop new collaborative relationships. One example is the Health First Collaborative, which responds to the twin pandemics of COVID and racism, and which is housed at Michael Reese Health Trust. The Health First Collaborative invests in community-led solutions, supporting demonstration pilots that can be replicated or scaled. The city-based First cohort is focused on community health centers as hubs of health transformation. There have been initial conversations about raising funds for and developing a Collier County pilot. The collaborative's pillars include racial equity, coordinated integrated care, cross-sector engagement, policy advocacy, and systems change. An emerging activity being incubated out of the Health First Collaborative is the Vaccine Core Partnership, which serves to coordinate resources and messaging to ensure that everybody in the metro region can make an informed choice and access the COVID-19 vaccine, while at the same time strengthening our public health workforce, which we hope will eventually include community health workers on the ground providing person-to-person communication. As we've heard, messaging and communication is vital, and bridges are being built between health departments, community-based organizations, and private health funders in order to reach vulnerable populations that may be hesitant about the vaccine and to get us each all out of our own respective silos.
Thank you very much. And I think my next question deals specifically with vaccine rollout. And I think for the two of you, as you look at your organizations and partnerships that you all may be developing, are there new partnerships that you're thinking about developing? And then on top of that, are there specific communities that you're particularly interested in targeting?
Sure. So I wouldn't say we're developing new partnerships. I think we're strengthening existing partnerships and actually becoming very intricate with those relationships with the partners that we're working with. And so the example that was presented earlier is our work with Cook County Department of Public Health. We are working with them to address any of the 1A entities that are not part of our health system, but working with people that are healthcare workers that need the vaccination. So we've partnered with them to address that. We also, in a larger context, work with various collaborations to strengthen some of the work. So the Alliance for Health Equity, one of the items that someone said was communication. We've worked with communicating about the different locations for vaccination. We also have worked with the mayor's rapid response team to address some of the issues in some of the communities that we are focused on. And so how do we decide on those communities? We target those communities with the highest disparities. And then we also look at the health gaps, which is our data will show us, these are the communities of color, those with lower socioeconomic status, and those that are hardest hit by COVID-19. But we also, with our 1B 65 and older population, we are, really have an equitable method of making sure that the sickest of patients are vaccinated. And so we're working in hand with a lot of these county health departments, the City of Chicago Department of Health, to address that.
And Ms. Silver, I didn't know if you had anything to add.
No, just that I echo what the other speakers have said, and also in order to save time, just to be able to reiterate some of the collaborations and partnerships that I had mentioned previously.
Perfect. Thanks so much. And I'm going to now move to, we've got several questions in the chat, and I would encourage people in the audience, if you have questions, to go ahead and put them into the Q&A section. But I guess one of the questions is about IDPH is reporting that only 20% of vaccines received by Walgreens and CVS have been administered. And so I'm just asking some of our local health officials if you have comments about that, or sort of what we can do we need to do anything to increase sort of the administration of vaccine? Thoughts?
Dr. Giles, I probably could take that. I was on a phone call today actually with Walgreens and CVS, and I think the person is actually talking about the long-term care facilities and the doses that have been allocated for skilled nursing facilities and also assisted living facilities. I do know that the first dose has been given now, according to CVS and Walgreens, to all skilled nursing facilities across the state. Allegedly that they will have their second dose by the first week or two in February. But ultimately, they've started doing assisted living facilities at this point, and allegedly they will be complete with all of these facilities that are in that federal program by March 7th of 2021.
Great, thanks for that. And I guess there's a question from Alan Rosenberg, who his partner organizations, Walgreens, Jewel Osco, and the hospitals all are using online registration. Has there been consideration how this might be increasing disparities? And I guess, I guess thoughts about sort of how we combat that. And I think, Mr. Pfister, you sort of addressed that with your vaccine ambassador program, but I guess I'm pointing to our colleagues in Cook County. Are there things that are happening in Cook County as well around this?
Yeah, well, that's a very good question. In fact, this new sort of unified online system that we have for expressing interest about vaccine and also making appointments, there is a hotline associated with that. And people need to be a little bit patient as we get the kinks out of it. But we realized from the very beginning, we did not even want this new website to go up before we had at the same time a hotline where people could get direct help over the phone, where they don't have to be using a computer, that they would be walked through the process, that they would give their information over the phone, and somebody at the other end would be typing in their information so that they could get sign up for their interest and potentially get an appointment. We understand that this creates large disparities for individuals that don't have computers or have situations where they're not able to use a computer for a variety of reasons. This is not enough. I think that we need to also be working more on the ground, such as we're trying to do with our community-based organizations, but that still doesn't really bridge that gap of making the appointment systems more accessible on a wider basis. And at least because we've centralized this in the county, we are ramping up more and more. In fact, we are hiring, or the health system is hiring more actually, agency folks to man that phone line so that people will not have long waits on the phone. But I think that we need to be doing more on the ground as well to get people accessible appointments throughout the entire region.
Thank you for that. Another question from Rachel Ferry. What role do you see for public schools, school-based health clinics and their vaccine efforts? School-based health clinic, Mercy Phillips and Dunbar High Schools vaccinating school staff and teachers now, and have done about 50 people. We have about 100 more appointments scheduled, but just your thoughts on school-based health clinics and their role. And this is to any of the panelists.
I can say that, in Lake County, we only have one school-based health center, and I operate it. So we'll definitely be using it for students. However, in Lake County, we have a different model that we're working with our school districts, and we're actually having 2 closed points of dispensing where all pre-K through 12 educators will come through, and that's both private and public schools.
Thanks. And then another question from William Werner. What role will community-based physicians play in vaccination rollout efforts?
I guess I'll take that one too. And so it's actually my hope is that every one of you that has a private practice, is that you get your iCare PIN number. And so we want to start distributing vaccine to as many private providers as possible. We have sent out to all our Lake County medical providers the how-to guide to get your COVID-19 vaccine PIN number. But that is something that we definitely want more and more community providers, because I'll tell you right now, at the pace we're going with the limited number of outlets for COVID-19 vaccine, is we're not going to get it done in a timely manner without having community providers being a part of it.
And let me just also, piggyback onto Mark. We have in Suburban Cook right now over 90 community partners or community partner sites, but that's still not enough. We are dealing with 700 square miles. And even though if you look at the map of where they're located, they're pretty uniformly spread throughout the county. That doesn't mean when you go down onto the micro level that is really sufficient. And what we need to be doing is right now we don't have enough vaccine to unload more partners, even if more are willing at this point, because we don't have enough vaccine to even give enough to the partners that we do have. So that's where we need to try to be a little more creative and potentially set up maybe a pop-up site, or to ask one of these partners to go to areas that are spots where we know there's sort of a hole in the coverage for vaccine. And eventually try to leverage more and more partners. I mean, I would hope that eventually, and this might be down the line, is that private physician offices, all the community-based clinics will get this vaccine in the armamentarium just the way they have flu vaccine, so that people can go to the places that they usually get vaccinations for their children or their flu vaccines for all ages, and to be able to then get the COVID vaccine. But that's not going to happen now. That's down the line.
Thanks for that. And I agree with you. I think part of a major step we have to do is to get the supply up, to meet sort of much of the demand. And I think we need to remind folks that in the meantime, wearing masks, being physically distanced, washing their hands is so vitally important as we move forward with this. One person asked if anyone knows sort of the final word on when Chicago public school teachers will be vaccinated. They are clearly part of 1B, so that should be coming soon, but I don't know any more about that. I don't know if anyone on the panel does.
We would have to defer to the Chicago Department of Public Health. I think they have plans on starting that process sometime in February.
And then there was another, I think I did that one. I'm trying to go through here. Our suburban county, I guess this is also to Cook County, are the suburban counties also using the community health ambassador model? Or actually, I guess it's to both. I guess this would be similar to a community health worker model. Thoughts on that? Both in terms of COVID, I guess, and prevention efforts, and also in terms of addressing vaccine hesitancy.
You know, I think that both Mark and I, you know, in our health departments are part of the Northern Illinois Public Health Consortium. And I think that all of our health departments, which represent all of those health departments in the collar counties and such, all have sort of their own different programs for doing this. But I think that it's core to all of our programs in terms of trying to have, if not an ambassador program, some sort of community outreach and community engagement with organizations that work on the ground, or individuals that work as community health workers, for example, or community organizers. And I think that every jurisdiction does this a little bit differently, but I think that it's something that everyone of my colleagues that I've engaged with has some sort of plan or process in place for this kind of outreach.
Great. Thanks for that. And then another question in the chat, someone from Oak Park says, our community is struggling with their health department. So I guess thoughts about sort of how people who may be struggling can reach out to the health department or other partners.
Well, yeah, and I guess this kind of goes into you know, struggling with their health departments. I mean, there's a lot of variation. I mean, I can tell you that, you know, every health department has different levels of resources. So, you know, when we start comparing, you know, what's happening in Lake County, where, you know, I almost have 1,000 employees because we're a community health center too, compared to some small health departments, I think a lot of this comes down to getting additional funding to assist those health departments to really, you know, meet the needs of their community.
That's great. And I'm going to go, this will be our last question because of time, but what are the elements for the most successful vaccine hesitancy programs?
Well, again, from my perspective, is that the elements that are most important is that, you know, a lot of the public, you know, certain elements of the public no longer are interested in scientific, you know, reasons why to get the vaccine. There's a lot of individuals that do not respond to shame or shaming people that you should do this because you're going to potentially infect your parent. What we have found is that it really comes down to, you know, those individuals that other people trust and can say to them, you know, I got the vaccine, you know, I feel good about it. I didn't have all these impacts. And I think that's where it really, no local health department can convince somebody to get it. It really comes down to the relationships that they have with trusted partners, faith-based, you know, pastors, priests, et cetera, that are really speaking why with the right information and correct information of why people should be vaccinated.
Great. Thanks for that. I want to thank all the panelists for really an outstanding session today. And I want to thank the audience for their great questions as well. And I'm going to turn things over to Dr. Whitaker to close us out. Dr. Whitaker, you may be on mute.
There you go. I said some great things, guys. I've now forgotten them all, but Dean Giles, thank you so much for moderating the panel today. Thank all the panelists, full of tons of great information. There are a lot of positive things going on. And I would say that this is really a Herculean effort, like none of us have probably participated in before. So I like the questions. Some patience, I think it's some good direction. The questions sort of tell you what folks are thinking about. If there is an opportunity to engage more trusted folks in getting the message out, I think that's going to be critical. I know that there's a couple things going on, but I hope there are more of those things that are going to be launching very soon. So we definitely want to get more people out of the hesitancy block into I want a vaccine. And as soon as it comes available, I'm going to go get one. I want to thank everybody for attending today's program, including Institute of Medicine Chicago Fellows, guests of ours who joined us, all of our sponsors, and I want to thank the Board of Governors for supporting all of the work that we are trying to do this year. And I am appreciating everyone for your participation. Please note that we'll be posting an evaluation for you to complete and obtain your continuing education credits.